are heard via the Jack Spring Electric Keel Newsmaker hotline. Dr. Alex Billioux is the Assistant Secretary of Health for the Louisiana Department of Health's Office of Public Health. Dr. Billioux, welcome to Keel. I hear you're concerned about health. How you doing this morning?
Good morning. I'm doing well. How are you?
Let's jump right into the governor's news conference yesterday. A continuation of what he calls phase 2 with limitations. We've called that like phase 1.5, but we're splitting hairs. Was there any consideration, because we heard a lot of rumors about a possible step back to 25% capacity, stuff like that? Was that ever really on the table?
Well, I'll say, as the governor said yesterday, when we're looking at data, looking at these decisions, we're always putting all of the information out there and considering every action. Certainly, looked at the White House guidance, which takes us a little bit further than where the current governor's orders are. It would reduce gathering sizes to 10. It would close gyms, and it would close restaurants or reduce restaurants down to 25% capacity. But having just made changes to phase 2 a little over a week ago, he thought it was prudent first to see, what is the impact of those changes first? Do they do what's necessary to stop case growth as we hope it will, without us having to take those further actions?
We spoke with Dr. Ghali from the Med Center up here not too long ago, and basically the same question we asked him. You see increasing case numbers, not only in Louisiana, but across the country. But how is it, Louisiana, compared to other states with hospitalizations and casualty numbers?
Well, the absolute numbers are not, very useful to compare because we all have different...
Pardon me, I apologize. What do you mean by absolute numbers? Explain what you mean by that.
What I mean is if we said, well, look, there's only, for instance, in Shreveport, say something like, there's only 300 COVID admitted patients in Shreveport, and there's, 2,000 in Dallas. Those are the absolute numbers, and it may not be helpful to compare that if, Shreveport can only really sustain 500 COVID patients, and Dallas has room to go, several thousand more. So what I guess I'm saying is it's really about how full or how much capacity do the hospitals have. And there we're definitely starting to see signs of strain, less so in your area, but starting to, and I'm sure Dr. Ghali shared that, more so in the Lake Charles, Lafayette, and even Cenla areas, where not just because of COVID, but certainly because of COVID admits, we're starting to see the hospitals really strain and have to do things like divert patients to other hospitals in the area.
Doc, we've been wearing our masks for a couple of weeks, and again, you're saying we're seeing hospitals strain. Are the masks not working? Are we not doing it right?
Well, I'd say that, first of all, we should have been wearing masks for a lot longer. And I do think that since the order, not from this Monday, but last Monday, we do have reports from other parts of the state that people are really taking this seriously now and wearing masks in larger numbers. Keep in mind that with COVID, your exposure can happen up to 14 days before you begin to have symptoms. And that's why we keep saying it can sometimes take, and often has taken, 2 weeks for us to see effects of changes before they really manifest. So if you take the example of the first stay-at-home order, we were on a really steep, steady increase. And we really first started to see that peak 14 days after the stay-at-home order. So we're still holding our breath and hoping that people are wearing their masks and that we'll start to see the impact of that next week.
Okay. This order goes right up until the start of school. Everybody asked you questions yesterday about school. Where are we with regard to school? All these kids coming back, kids are germ spreaders. We hear that all the time. Are we just setting ourselves up for a worse fall?
Well, so I think what we are certainly concerned about is that anytime you're going to bring together people like this, and especially children in the school setting, there's the higher risk of transmitting COVID. There's the adults that are around them, both at school and at home, that would bear an even larger risk. But there are steps that we think we can take to reduce the risk of spread, to make it less likely that COVID spreads like wildfire in schools. What we don't know is where we're going to be at the start of school season. Again, to the point of, you've been wearing masks. Are we going to see that the cases are starting to decrease? Are we going to start to see that really with that mask wearing, people are being consistent with it rather than just, wearing them under their noses and only wearing them occasionally at certain places that look dirty versus others? If we can be consistent about mask wearing, if we can keep pupils, 6 feet apart or more, it may be, and we get, case growth down, it may be reasonable to have that in-person school start, maybe a little delayed, maybe on time, depending on what's going on in your area.
You just used you just used an interesting term, spread like wildfire in schools. To this point, what evidence is there from last spring that it is going to spread like wildfire in schools?
Well, I mean, the challenge is we don't have direct evidence of spread in schools, at least in most parts of the state, because we were right at the end of the school year, if you recall, and frankly, the stay-at-home order was put in place pretty quickly after we started to see really high case growth in our community. So we don't yet know what that's going to look like. What we do know is what's happened in other countries that have opened schools, and even in Europe, where their new case numbers are much, much, much smaller than ours. They have seen transmission happen in schools. South Korea has taken a much more aggressive stance with tracking new cases and really getting control over the virus. But even there, they've had to rely on a fair bit of virtual schooling. And I guess my long-winded answer was going to say is I think we should be prepared for virtual school. I think even if we're able to open schools in person initially, as we enter the fall, we should be ready for the need to potentially go to virtual school. This is going to be an odd school year, but I think we can get through it.
We had Attorney General Jeff Landry on yesterday, and he said he just sort of a rhetorical question that was very interesting, and I'd like you to comment on. He said, so how long can we stay in crisis mode? How long can we stay in crisis mode?
Well, I mean, I think that's an interesting rhetorical question. I'd say that COVID gets to dictate how long it's sticking around. And certainly we can bring new resources to try to manage it better. We've got new medications. We've got new science, like the science about masking, every day that helps us understand how to manage that crisis better. But believe me, if it was as easy as wishing COVID away, we would be done. And so it gets to dictate the timeline to some extent.
Let me ask you about the numbers. DeSoto Parish is now finding COVID-19 duplicates. The same was reported in Red River Parish. We talked to Dr. Martha White about that. What can you explain to clear that up? What has happened with regard to duplicate numbers that they're now reporting?
Yeah, well, I think that the challenge is that the lists that parishes get are different than the overall list that we maintain in the Department of Health. What we're giving first responders are a list of new cases, new individuals in that parish who we've identified have COVID, and that's really not being given to review as a list. It's being given to enter into the systems that they use for deployment of resources to individual homes. So if I'm being called to a fire at a house, it'll tell me, oh, by the way, this house has been identified, somebody in that household has been identified to have COVID. So you really can't take DeSoto's list or Red River's list and all the information that we're sharing them and then create a list of, hey, I think I should have this many people. And that's not what the LDH website shows. Those lists change on a daily basis. We deduplicate or identify the same individual who may be listed twice in our system every day. And we also identify where somebody, maybe a hospital, has said this person's a resident of DeSoto Parish, and we're able to look at their information and define actually they're not in DeSoto Parish, they're in a different neighboring parish, and move that case to the appropriate parish. So as we do that, their lists in the parish at the parish level don't always, live up to what we have at the state level. So we had a call yesterday to explain that to them. But what I can assure the public is, every day the list that we have is the most accurate to the best of our knowledge. We use both an automatic computer-based system to identify this is the same person, and a manual process to say, actually, I think this is also the same person, and we only list one person per case.
Doc, one more thing, real quick. In the governor's order, people don't understand that we shouldn't be going out to eat with people that are not in our immediate household. Is that accurate?
Yeah, well, I think that's right. Especially, I mean, you could maybe go out to eat, but stay more than 6 feet away from people, and especially if you're going to be eating or doing something where you have to take your mask down, you really shouldn't be with people outside your household. I think the other thing that we've forgotten is this idea of new normal. We talked a lot about it when we moved from stay at home to phase one. We're not going back to normal daily life. We're going to a new normal, and so people seem to over time have forgotten that. We really aren't saying you should be, if you're somebody who went out to eat, 5 days a week before, that you should resume that habit. You should be mostly staying at home. You should mostly be staying with your household. You should always be wearing a mask when you're out in public. And so it's not a matter of just going back to, 7 days a night or 7 days a week being out. That's going to put you and your family at risk.
So pardon me just a second. Last 30 seconds just to clarify. In your opinion, from what I just heard you say, that even though we are sort of at phase 1.5, in your opinion, phase one is the lifestyle people should still be living?
Yeah, and for some people aged 60 or 65 and older, people with significant health concerns, they should be in phase zero. And that's also in every order that we've put out for each phase, 1 and 2, that if you're in those high-risk groups, you should be staying at home.